So today we are going to be focusing on careers in alcohol and drug services. So our speakers today are Marlee Turner, and she is the AmeriCorps Vista for the Sacramento County Opioid Coalition. And then we have Dr. Andrew Mendonsa, and he is a health program manager for Sacramento County Behavioral Health Services. And then finally, joining us from the mountains, I see, we have Dr. Neil Flynn, and he is the medical director for Sacramento Transitions Clinic. Again, there'll be ample time to ask questions after all the panelists have had a chance to speak. And as a reminder, add your questions to the chat as you have them. I will make sure to try and go over all of them as we have time. So Marlee, I believe that you are up first, my dear.
Hello, hi. Sam, do you have the slides?
Yes, give me a second.
Cool. No, they're not like extensive, it's just like pictures. I feel like pictures helps. So, hi everyone, my name is Marlee Turner. I am the AmeriCorps Vista Volunteer for the Sacramento County Opioid Coalition. So today I'll talk about the work that I've been doing in that, and then more about my background and how I discovered my interest in health and medicine. There's the next slide, I don't know, please. Thank you, cool. So just to like give an overview, I'm going to describe the AmeriCorps Vista program. It's a volunteer program that that people who've graduated from college or even just high school can do, and then people, even adults, well into their careers, can volunteer. And it's a year-long service, and I'm a part of the AmeriCorps Vista program. And the goal of Vista is to volunteer for nonprofit organizations and help them build capacity in their local communities, like capacity in depending on what they need. So I am with the Sacramento County Opioid Coalition, and I'm helping them build capacity in their ability to reach more people. So the Sacramento County Opioid Coalition is a collaboration of healthcare professionals, community-based organizations, law enforcement, and county agencies, and just regular concerned citizens. So for example, we have people in our coalition from the Substance Use Prevention Treatment Services of Sacramento County, people from Sacramento State College and their pharmacy, and even people from the Sacramento Valley Medical Society. And so we all work together to prevent opioid overdose deaths in the region of Sacramento. And so we meet regularly to discuss issues and make a plan to create projects that'll help reduce opioid overdose deaths. And so opioid use disorder is a big public health issue currently. In 2019, almost 50,000 people in the United States died from opioid overdose. In Sacramento County in 2019, 119 people died. And we know these are preventable deaths, and we hope to prevent these deaths by informing people of the dangers of opioid use and helping them and preventing people from using opioids in the first place. But there are over 2.1 million people in the United States who have opioid use disorder currently. So a lot of our work is focused on getting treatment for people who already have opioid use disorder. But it is hard for people with opioid use disorder to get treatment. There's a lot of stigma for people with opioid addiction. Stigma is defined as a mark of disgrace associated with a particular circumstance, quality, or person. And so people who are addicted to opioids, drug addicts, have a lot of stigma against them, and stigma means that the people who need treatment are afraid to get treatment because of fear of judgment. They're afraid to get help. So the Opioid Coalition, we are focused on changing that. Oh, Sam, can you do the next slide, please? Sorry. So these are just some more facts, some graphics. But we want to help people with opioids get treatment, and we really want to help inform the public that opioid use disorder, it's not a choice, it's a disease. You wouldn't get you wouldn't judge someone for getting a cold or the flu. Like the best thing to do is to help them get treatment, go to the doctor. And that's exactly what we want people with opioid use disorder to do. And we want them to feel safe in our community to be able to do that. So more specifically, like I, as the Sacramento County Opioid Coalition, Vista, AmeriCorps Vista Volunteer, it's a long title. I've helped develop the website so that we can take all this information here and a lot of more information and help distribute it to the public. Because of COVID, it's harder to visit people in person. So we focused on building our virtual platform, building our website, and distributing things virtually. We've also created videos to distribute on Facebook and YouTube to help inform people of opioid use disorder in Sacramento County and inform them that people with addiction, they have a disease that can be treated and it's that they can recover from that disease. And so that's overall kind of what we've been doing. If anyone has more questions about that, just ask. So now I'm going to move over to how I got interested in AmeriCorps and medicine. Next slide, please. So a little about me. I graduated from Georgetown University in 2020, and I studied public health. I'm from Washington State, and I'm from the Pacific Northwest, and a lot of my hobbies are kind of fit that stereotype. I like my dogs, and I like nature and swimming. It's just a little of that. And I discovered I was interested in medicine in high school. So then I studied public health in college, and I volunteered in public health activities in college. But I still wasn't sure what I wanted to do. So I kind of just focused on, I like healthcare and I want to do service. And I found AmeriCorps just online, and I applied, and I just picked the job that first came up because I didn't want to wait around. I found personally I plan too much, and I'm always waiting for the plan, everything to fit together. So personally, if I'm always moving and doing new things, it helps me figure out stuff more than if I'm just sitting around and thinking about it. So I'm glad that I took the job. And I chose to work in AmeriCorps in California because I went to college in the East Coast at Georgetown, and I missed the West Coast. So that was just kind of a geographic location thing. I miss the West Coast. I miss nature. And I'm glad I did, because experience has taught me that I like public health, but I also miss medicine a little bit. And I've met a lot of good people who helped me discover that, you can do medicine and also advocate in health policy. And then the next slide, please. And there's even further more about background. The reason I started getting an interest in healthcare was because when I was in high school, I injured myself playing volleyball, and I needed surgery. And I went through the whole healthcare system. I went to the emergency care department. I went to just a normal doctor, and then I got like x-rays and MRI. And then I eventually just got surgery with an orthopedic surgeon to fix my shoulder. And that took months of recuperation. And I worked with a physical therapist. And every person I worked with was super nice and helped me learn more about what was going on. And that just really interested me. I found that if I just I really like learning about things. And the more I learned about it, the more I just wanted to work in that field. And then my second experience was with when my grandma died. It's a little more sad, but it was still enlightening because she was admitted to the hospital and basically entered the end of life care system. She was just old and her body was breaking down. And that taught me that medicine, it's not just about finding a solution, because sometimes there isn't a solution, but we worked with really good doctors and nurses who helped take care of her. And I discovered that medicine isn't just about like solving a problem, but it's about taking care of people. And I discovered there that I want to be able to serve people. So even though there isn't always a solution, it's like if you do your best, you can help someone, you can prevent them from suffering and help take care of them. So overall, that's that. So after that, I just volunteered at the hospital and then just decided that I wanted to work in healthcare. That was actually kind of fast. So, but.
Marlee, can you talk a little bit about AmeriCorps Vista itself and how long the volunteer hours? Do you get paid a stipend? And do you receive any money to continue your education by going through AmeriCorps Vista? And guys, AmeriCorps Vista is all across the country. And they work not just with opioid coalitions like Marlee is doing, but usually they are volunteers with other nonprofits, not necessarily in healthcare. So it's a great way to pad your resume and get that first job experience that you might need after college. So if you could answer that, Marlee.
Yeah, so I focused on healthcare because I was what I was interested in, but AmeriCorps does have a lot of programs. They have a traveling program, so you can go around the country doing different, like more construction work projects. Mine was Vista, so it's volunteer at a nonprofit. It's a year-long commitment, and you get a living stipend. You get paid twice a week. And it's you get paid depending on what area you live in. So if you live in like a really expensive area, you'll get paid more because it costs more to live there. So like San Francisco, would you get paid more than if you live in a rural county. But it's not like it's called a living stipend for a reason. It's for like living, and beyond that, I mean, some people get extra jobs, but it's mainly about the experience, helping figure out what you want to do, and just meeting new people to help you figure it out. And then after you finish your year-long commitment, you can extend it, or you can not extend it. And then after you finish, you get like an extra money stipend, or you get an education stipend that'll help you pay for more college, graduate school, some other type of education. It's pretty flexible. So it's just your choice. I chose the education stipend because I know personally that I want to continue in education, probably in medicine. So that it's a great opportunity to, it's like if you graduate, when you graduate college, or some people do it before college, you don't know exactly what you want to do, but you want to gain like what I did. You want more experience. You don't want to like wait around and plan. You want to do something right away and meet new people and get that experience. I would recommend AmeriCorps. And there's so many options in so many different geographic locations. It's pretty flexible.
Awesome, thank you, Marlee. While the next speaker's up, could you throw the AmeriCorps link into the chat so the kiddos can look into it? So next, we have Dr. Andrew Mendonsa. Please take it away.
All right, I will go ahead and share my screen with you guys. Hello, welcome. Thank you so much for having me. I'm really excited to be here. When I heard about the opportunity, I was just really excited to share some information with you all. A little bit about me. I am a clinical and forensic psychologist by license, so licensed here in California, also licensed in about 21 other states. So if folks are interested in stuff in other states, feel free to reach out to me. I'll give you my contact information at the end, but I oversee the substance use prevention and treatment unit for the county, for Sacramento County. So if you are interested in working for the county or what we have to offer, volunteer opportunities to pad your resume, anything like that, definitely reach out to me. We'd love to talk to you and get you connected, both volunteer opportunities here in the substance use unit and also in the mental health unit. We have lots of opportunities for students and folks that are looking to come into the field. So let me go ahead and share my screen and I'll go ahead and kick it off here. I don't want to take any time from Dr. Flynn. Can everybody see my screen okay? All right, good. Thank you, Lindsay. All right, so what about, so what does my unit and what does my department do here at Sacramento County? Well, we do a lot. And there is a lot that's needed, and we do as much as we can, and there's still not enough getting done. So that's why we hope that you all will consider careers and work in the substance use prevention and treatment profession. There's a ton of work. I'll talk about that in just a few slides. We have no shortage of openings and opportunities for a good, well-paying career. So what does my unit do? We do withdrawal management. Sometimes you might hear it known as detox. So we do offer withdrawal management detox services. So helping folks that need to kind of taper off, say, alcohol, or if they're into like anxiety medications, things like those. You can't really stop cold turkey. They're extremely dangerous to stop cold turkey. So we offer services that help you kind of taper those and get off of those healthy and without causing any medical problems. We offer residential treatment. We offer outpatient and intensive outpatient services. Prenatal services, so folks that are pregnant, we have very specialized services for folks like that. Prevention services, so we do believe in prevention here in Sacramento County. We put a lot of resources and money and time into that. We know that prevention is the sole key to stopping a lot of the things that are going on in Sacramento County, and so we really focus on prevention as well. We offer aftercare and recovery services. So we know when you go into treatment, just because you got clean and sober and you're on a couple of weeks or maybe a week or two or maybe a month of sobriety, maybe that's not enough to keep you stable long term. So we offer some services that keep you really connected for 90, 120, 6 months, 8 months. So really kind of getting some really strong sobriety and recovery underneath your feet while you move forward. We do a lot of services with CPS, with probation, juvenile hall, Sacramento County Jail, RCCC, out in Elk Grove. So we do a lot of services with a lot of different agencies and departments among Sacramento County. We're considered subject matter experts. All of us in our unit are passionate about substance use. We're trained, we have extreme background in it. Most of us are licensed professionals, either licensed master's folks, so like LMFTs, licensed marriage and family therapists, licensed clinical social workers. I'm the only psychologist in my unit. There's a few of us in the department, but I'm very, very blessed to be the psychologist in our unit. And then we're very passionate public employees. Most of us have long tenure with the government, either state or county or both. So we're very, very passionate to really bring an end to the substance abuse problems that are plaguing Sacramento and California. So I want to go over some ideas when we talk about some jobs within the alcohol and drug and addiction areas. A couple things to think about. We have addiction medicine. So I'm sure Dr. Flynn will talk a little bit about that, but that's specific for like detox, withdrawal. We use MAT, and that's called medication assisted treatment. So for folks that are coming off like opiates or painkillers, things like that, there's actually medication that you can take to actually help kind of taper yourself off of those things. So you don't have to get those chills, cold turkey, all the withdrawal symptoms sometimes. So we have really, really good medication for that. And that's done by our physicians and our physician allies. And then also for co-occurring. So folks that are like, well, I have a passion in substance abuse, but I also have a passion in mental health. Well, that's called co-occurring. And so we do a ton of services in co-occurring. We work closely with our colleagues across the aisle in the mental health division, and we do a lot of joint ventures and joint treatment. So kind of giving you an overview, depending on where you want to go in your career, there's something for everybody. For those of you that are physician bound and want to be physicians, I was one of you. I wanted to be a physician, and then I couldn't pass chemistry. And so I decided to go into psychology instead. But we have psychiatry. So those are for our medical, our MDs and DOs, folks that went to medical schools. Psychiatry is an option. Addiction medicine is an option. If you prefer to go psychology, like me, you would be a PhD or a PsyD, so a doctor in psychology. And so for me, I'm certified and licensed in clinical and forensics. So I do a lot of stuff in like the courts and prison, on death row, a lot of stuff like that. So a lot of like profiling, a lot of like getting into folks' heads, assessing them, things like that. Psychologists, we do not prescribe medications in California. Some states we can, in California we do not. So if you're really wanting to prescribe and have those rights, you would want to go into the more physical health realm. So for our medical schools, nurse practitioners, PAs, things like that. We also have opportunities for mental health and behavioral health, and those range from folks that have bachelor's degrees, master's degrees, doctoral degrees, social work, bachelor's and master's. And then we have substance abuse treatment professionals. Those are folks, you can get jobs in substance abuse treatment with as little as a couple hours of training, all the way through an associate's degree and then all the way up. So a lot more opportunities as folks are kind of starting out in their career. Will sometimes start with like substance abuse treatment and then kind of find their passion as they kind of continue to grow professionally in their work. Some of the work settings, this is not a full comprehensive list, but just some that I've worked in or are very common in substance abuse. Everything from private practice, so you're working by yourself in your own office, all the way to public settings. Like I work for the government, I've worked for the state. I was the chief psychologist for Department of Corrections, the prison system. There's a ton of opportunities there, and jails, managed healthcare like Kaiser, tons of opportunities for addiction medicine and substance abuse treatment at Kaiser, for example, Dignity Health, Sutter, My wife's in leadership over at Sutter Medical Center, and she said they're always hiring in this field. And so again, no shortage of jobs for you guys as you embark on your future. Military has really great opportunities as well. Hospice care, folks that are into hospice are working with folks that are kind of at end of life and are kind of looking to transition to the next life. If you're really interested in that, hospice is good. Like I said, employee assistance program, prisons, substance abuse treatment centers, detox facilities. Do a Google search for jobs in this industry, and there are a ton of jobs right now. It is a thriving area right now. All right, let me go ahead and get into some education and training. Some folks are interested in that. I already touched on it. Everything from if you have a few hours of an online class, you can get into this field, all the way up to going to medical school, getting your PhD or your PsyD, and everything in between. Sacramento, we're very blessed to have a ton of colleges, both private and public. So really there is a way to get into any of these areas just within Sacramento. We have some really good universities and we have some really good training programs here in Sacramento. I was blessed. I did all of my training. I was born and raised in South Sacramento, grew up super poor, and said, you know what, I need to make a difference in my life. The only way I'm going to do that is by going to college and making a difference for myself. And so I did that. I was fortunate to be able to go to Sac State, got my doctorate here in Sacramento, and then did my residency over at UC Davis Medical Center. So there's a way to stay in Sacramento if you want to stay in Sacramento. Otherwise, the sky's the limit. Lots of good colleges and programs all throughout the nation. So job outlooks, there are lots of jobs right now. So looking at the behavioral health. So for those of you that say, I want to do mental health, I don't really want to do addiction or substance abuse, tons of jobs, tons of opportunities. Currently, the Department of Labor is looking at about a 25 to 35% growth. That is significant. Usually growth is between 2 to 5, maybe 7%. So when we see industries growing at over 25 to 30%, be assured there's going to be a lot of opportunities there. So again, if you're really looking to position yourself in an industry that's going to be able to take care of you long term, this is definitely the industry for you. Over the next 5 years, significant growth. And it's over here at the Bureau of Labor Statistics. I'm going to give you my email address and my phone number at the end. So again, if you want any of these studies or anything, feel free to reach out to me and I'll get those over to you. Looking at our looking at our psychiatry and addiction medicine. So folks that want to go, say, the medical school route, again, no shortage of opportunities. Looking to grow about 10% throughout 2029. Psychiatry is looking to grow about 12%. And again, compared to on the average, some medical areas are growing at about 4%. We're talking about 3 times the growth in a lot of areas. And I know I have a ton of friends who are psychiatrists. They are just inundated with work opportunities. So again, a lot of work, a lot of opportunities. If this is what you want to do, say psychiatry, or going to medical school and using your medical training to work in this industry. Substance abuse professionals, folks that only want to do substance abuse, there is a ton of opportunities. We have severe shortages now. I think I was preparing for this presentation, and I think I counted no less than like 100 openings in Sacramento across state, federal, county, and private organizations. And this is growing again at about 20%, much faster than the average industry is growing. So no shortage. I can speak just because I do this for a living. We have a ton of money coming from the feds and the state into county youth services. So we have a lot of opportunities, a lot of new programs, innovative programs coming out. So again, with new programs comes a need for workforce. So again, that means jobs. So my last thing I just wanted to kind of go over is my contact information, and then I'll hand it over to Dr. Flynn here, and then I'll make myself available for some Q&A at the end. But the County of Sacramento, like I said, we have a ton of opportunities for volunteers, depending on what you want to do. If it's just something that you want to do a couple of days a week, you want to just do it for a short period of time, long period of time. I'll give you a little bit about my background so I can give you my trajectory. I was similar to you guys, medical school bound, but I found out very quickly that good programs are competitive, right? And so you guys know this, you're all smart. That's why you're in this program. So really work hard to get your resume, with good stuff. I have an MBA as well. So I went to business school in addition to my PhD. So I do a ton of business consulting. And I always tell folks that are asking me for business advice or for career advice, I tell them one thing: what sets you apart from your competition? And so you want to be thinking about that as you're like looking at colleges, you're looking at volunteer, you're looking at how you're going to get into medical school, or if you're going to go into PhD program, for example, what sets your resume aside and apart from all the folks around you? And so you want to have things like volunteering. You want to have, you did this, you were part of a research study, you did some volunteer work, some data collection, all those kind of things. People like me who hire and do big stuff. When I see that stuff on resumes, I'm picking those folks out. I'm making sure that those folks are on the top of my list and calling them for interviews and calling them back for opportunities. So I give you that. Feel free, I'll put this in the chat as well, my phone number, my desk office number, and my email. Feel free to reach out to me. I love mentoring folks. I have a few folks I'm mentoring from a couple different schools and universities. Feel free, ask me like, hey, what do you think about this? Or would this be helpful or hurtful in my career? Or hey, the substance abuse, if I got into substance abuse, could I do this? And I'll really help you, kind of help you with that path. Really, you can't go wrong in behavioral health. I was all behavioral health and mental health, and then I became passionate about addiction medicine, and now that's what I do. And I didn't have to go back to school or anything. They're very similar to each other, so you'll find that you can land in both mental health or substance abuse with just the same kind of training, either or. So it's a very easy crossover. So with that, I'm going to hand it back over to you, Lindsay, and then I'll be here for Q&As as well at the end.
Perfect. Thank you so much. Guys, make sure add your questions to the chat. Like I said before, we'll go over them at the end of the presentation. So finally, we have Dr. Neil Flynn. Looks like you're in a very gorgeous setting, Dr. Flynn. So please take it away.
All right. Could I have my slides, please? Yes, I'm up in the mountains, and due to the wonders of technology, I can talk with you and feel the breeze at the same time and hear the trees and the wind. So I'm a physician, been a physician for almost 50 years now. Next slide, please. Being a physician is always interesting. It's an opportunity to work with all kinds of people like Andrew and like Marlee, and nursing personnel and multiple specialties. My specialty was internal medicine and infectious diseases. We were sort of the people who think a lot and don't do very much, according to the surgeons. And the surgeons are those, well, I won't say they do a lot. So mine was internal medicine. For 35 years of my career, I was treating primarily people with AIDS. AIDS came on the scene when I was a young doctor, a professor. I'm sorry. A young professor, and the people who got it were very stigmatized, as Marlee mentioned earlier. No one wanted to treat them. In the beginning, it wasn't clear how the stuff was spread, so people treated them like lepers. They also didn't like people who were gay, homosexual, or didn't like drug users. And interestingly, in my clinic, I started the first clinic in the region, and within a year of starting that clinic at UC Davis, we had 300 patients, and about a third of them were people with addiction. That is opioid addiction or meth use or cocaine or that sort of thing. And that's how they got their HIV, through injecting drugs. And about 2/3, well, not quite 2/3, were men who have sex with men. And then the third group were, interestingly, women who had sex with men who had sex with men, or they had sex with men who used drugs. So watching the waiting room, you'd see them split up into groups. The gay men didn't want anything to do with those addicts, and those addicts didn't want anything to do with those faggots. And so it was a real lesson to me on looking beyond what people say you are or they are. And I'll talk more about that a little bit later, and take into account the person. I was a professor of medicine for 35 years, teaching medical students, interns, residents, and trying to juggle a family, patient care, research, and administration. And it was always a challenge. And I have to admit that I often did not meet it. I didn't give any one part of the equation all of my attention. I couldn't, because I loved my family. But never quite able to do it all, or felt like I didn't, at least. I've retired from AIDS work because it required me at age 70 to stay up to the minute on treatments and so forth of multiple disorders, multiple diseases. And I became interested in one disease, that of opioid dependence. And I had worked with these folks because they got HIV and they got hepatitis C, which I treated, and all those things. I became interested in them and figured at age 70, where they say you can't multitask anymore, you can't remember things, that I could at least talk with people about a small subject that I knew a great deal about. So over the past 12 years or so, I have treated opioid dependent folks with what's called medication-assisted treatment, and that's with a medication called buprenorphine. And maybe we can talk about that a little bit later. I'm not ready to retire yet because I find myself really interested in the lives of my patients, the lives of people who are opioid addicted. They're interesting people. They come from all walks of life. If you met one in the supermarket or the store, you'd probably not know that they were addicted. They're ordinary people like you or me. And the stigma that they carry with them is totally undeserved. Much of what we think about drug users comes from the ways that we have treated drug use in this country for the past 50 years. I was alive when President Nixon declared a war on drugs. And I've come to realize, and many of my colleagues have come to realize, there's really a war on drug users, a war on people of color in particular. Their sentences are 2 to 3 times as severe as people of white color. So I became interested in this addiction medicine, and I now have a cohort of about 600 people who are opioid addicted that I and my colleagues care for. And I find it interesting every day. Every patient that I talk with is interesting. Every patient has their own story. And every patient is suffering the anxieties and the pains and the things of everyday living. And that's where I believe I can help out the most. Next slide, please. The training is long to be a physician, no matter what specialty you choose, 11 to 15 years after high school. But you're never bored during that time. You're constantly studying for examinations and that sort of thing. It's costly. Nowadays, most medical students come out of medical school owing perhaps a little over $100,000, which sounds incredibly big, even to me. But there are scholarships. There are ways to pay back that debt. So I urge you, if you're interested in medicine as a career, don't think about the money. To heck with the money, it will take care of itself. The hours are long, 12 to 24-hour shifts, getting shorter because it's been found that when we did 24-hour shifts. Oh, thanks for the info, Lindsay, on scholarships. 24-hour shifts, we don't function well and we make mistakes and we're not good doctors. And so nowadays, the 24-hour shifts are generally shorter. You need stamina, but don't worry, you're young, you have it. It'll come naturally. It's very difficult for your families if you plan to raise a family. Time and stress have to be carefully managed by you and the entire family, and hopefully by your colleagues as well. Burnout is common, and nowadays we try to prevent it with various programs and teaching each other to let down our guard and not be so into our own minds and not willing to allow anyone else to help us. Education is lifelong. Recertification in your field of interest is about every 10 years, and you have to study like crazy to get recertified. Income, you will never, if you become a physician, you will never be poor. The salaries are generally $200,000 to $400,000 a year, which sounds like a lot, and it is. It is a lot, and I acknowledge that. And the disparity between what doctors make and their patients make, in my opinion, needs to go down. And hopefully your generation, you that are listening now, will be able to find ways of evening out the road for people where such extremes of poverty and inequality in income are somewhat more even. Next slide, please. So what does it take to be a physician? Well, desire to be, of course, but you need to be concerned and compassionate about other people, even though they're different from you and you've never met them. I think it was Mark Twain who said, "I never met a person I couldn't like," and I've kind of carried that throughout my career. Now, if you asked me whether I would like doing medical care for Donald Trump, I would say no. Would I do it? Of course, it's my oath, and I would give him the same treatment that I would give to one of my opiate using patients. You have to have respect for others, respect who they are, where they came from, what is their story, what is their background, what, as Shakespeare would say, slings and arrows have they suffered in their past, and show that you understand and have empathy for them. You need to have some empathy. Not all physicians have it. I've met a number of physicians, both on a personal level and a professional level, who aren't very compassionate, but they do a damn good job in fixing your eyes or taking out your appendix. Fine. I couldn't do that. I'm not equipped to do that. So medicine needs all kinds of people, but I'm saying generally, the more you can have empathy for someone else, the better a physician you will be, regardless of your specialty. Learn to think critically. The things that are going on in our world in America today, and all the fighting and political wrangling and so forth, I believe are because many people don't learn to think critically. And that means simply that question what you're told as truth, go online, check things out. You've got an enormous database to choose from. When I was a young physician, I had to spend 4 to 6 hours a day in the library looking up maybe 10 articles on one disease. Nowadays, I can do all that in 15 minutes on the internet and get a better view of that disease than I got with 4 hours of library work. But think critically, look for evidence for and against what you believe. And that goes especially for physicians. One study published in the New England Journal, maybe 20, 30 years ago, showed that half of the things that I learned in the last 10 years and based my practice on, in the next 10 years, 50% of that information will be shown to be false. So it makes you a little bit circumspect about saying, I know the answer to this, and I know what to do. It should be more like, well, what we have today and what we can do today is this. And I'm giving you choices of what you place a value on in terms of the treatments that we can give you. You need to have a sense of the awesome responsibility for the well-being of the person in front of you, the patient, because they're a world unto themselves. They have a past, they have a present family, they have a future, they have work, they have all kinds of passions. And all of those things hang sometimes in the balance between being destroyed by illness or being returned to good health and the person moving on with their lives. Look for people looking like the people that we treat. And this has come to light because of Black Lives Matter. From the very beginning, I guess because my parents taught me to make few distinctions among people and look for similarities. Nevertheless, when I look back, there are things I could not do for an African-American patient. Sometimes the African-American patient had in their mind that I was just another Tuskegee doctor, a doctor who would experiment on them. Yes, I experimented, but always with complete understanding of the patient and complete consent by the patient. We go through a very rigorous set of rules in order to try to move medicine forward by comparing one treatment to another. But Black Lives Matter has brought it home to me that even though I'm a doctor and the patient sitting in front of me might say he's well trained and so forth, if I don't have the cultural background that that patient wants, I'm not as therapeutic as someone who does. And for that reason, I hope that we are going to see more people of various ethnic backgrounds become doctors and fill positions in all of the professions that you've heard about today and you will hear about in this course. Diversity is a wonderful thing, and we must not just embrace it, but actually make it work. Being a physician is tremendously anxiety-provoking, draining. Burnout is common. Physicians who aren't smart enough to seek help from our psychologist friends or our therapist friends or our psychiatric friends, we aren't going to function as well throughout a long career as those who are willing to drop their guard and trust other people and be the patient instead of the doctor. Last slide, please. So what does it take to get into medical school? I don't know how many of you want to go to medical school. Maybe that could show up on the screen a little bit later. It takes reasonable intelligence and grades in high school, B plus or better. My high school grades were maybe a 3.4. Back then we had 4.0 was limit. There was nothing above A. So maybe 3.4, 3.5. In UCLA, my grades were maybe 3.2, 3.3, not stellar. And I know that you'll be competing against people who have such grades, but we're not necessarily looking for that in the medical profession. That's fine for a researcher, but how do you get a patient to take medication? How do you understand a patient's cultural background and help motivate them to become well again? Get your feet wet. Test whether you really want to be a doctor or not. Go volunteer for things. One of my most recent research assistants finally got into medical school after about 6 years of trying. And in the meantime, he went off to be in the Peace Corps in Fiji, and came back with a more mature and more life experiences than the other people that we're interviewing with straight A grades. And he's now a medical student. He will be an extraordinary doctor. Don't worry about the money. You'll always find the money. And when you're a doctor, you can put that incredibly huge salary to paying your debts back if you have to, but hopefully you won't have to. Don't worry that you're the first in your family to go to college or to become a doctor. I was the first in my family to become a doctor. I came from parents with bachelor's degrees, so I had an idea of what I was getting into, but you don't have to have family that are like that. And have faith in yourself. As you heard earlier, having faith in yourself is the only way that you will get there. That and the phrase never give up, never, that will get you through. And I thank you for listening.
Thank you, Dr. Flynn. Quick question for you. Have you ever faced any really difficult situations while treating your patients?
Oh, many. I'll remember back in the early AIDS days, many of the parents of young men with AIDS would not come to see them. They would essentially banish them from the family because they were either homosexual or drug using. And I would have to make calls to those parents and try to convince them that their son was dying, and if you don't get here, you'll regret it. So that was difficult. Some other decisions, rarely did I have to make a decision about keeping someone alive or not. We did what we could, and our medicine was imperfect. So the difficulty is understanding that you are limited in what you can do, that you can't save everybody from death. As I approach 73, as I approach it, I get more of an understanding and more of a feeling of what those younger people were going through. But those were the difficult decisions. It was difficult to give up AIDS work, but like I said, because of my age and not wanting to work as many hours as I used to, then I turned to addiction medicine, a much more limited field where I could know a lot more about a lot less.
All right, guys, type your questions into the chat or raise your hands if you have them. Marlee, you mentioned that, well, you told me this one-on-one, but you mentioned that you're interested in going to medical school. What made you decide to go down that road?
I guess it was actually a question that I ended up working with Medical Society because I met a lot of doctors who do public health advocacy and work in health policy, which is what I studied, but then they're also medicine. And so I found that like day to day, even though I really do care about public health and health policy goals. Personally, I like sciences, and I like patient interactions. From volunteering at the hospital, I was able to, I mean, I didn't like treat patients, but I would like help them navigate the hospital and talk to them, and I enjoyed that kind of interaction. So for me, it's like I like one-on-one interactions, getting to know a patient, a person, and their story, and then doing what I can to help them. That's a very like medical professional experience. Like when you work in like a public health office, you're like a more office work, or you're working on big projects, but you don't necessarily get that patient interaction. So just from my experience working in public health, I like it, but I miss something else. Like every day, what I want to do. And so now I'm thinking of medical school
Let me
to
make
kind of
a comment on that also. I came from the other direction. I became a doctor first and then became interested in public health. I think the blend of the two things is marvelous, because not only are you thinking of the patient sitting in front of you, but you're thinking of them, as Andrew Mendonsa does, as part of a population of people with similar problems. And as you're talking to the one patient, your mind is racing. How could I prevent this in someone else? How could I intervene? How could I expand services? And that's really why I went into the addiction medicine, starting with a few patients free of charge for a couple of years, so they could teach me what I needed to know. And then now having 600 patients, a public health intervention. Thanks to the county and to your work on the opioid task force, we have more resources than we had previously. So public health is very important to medicine. And I went back for a master's of public health for 1 year, and the real public health people kind of laughed at us because we just took 1 year, and because we think doctors can learn anything real quickly, I got a master's of public health, which they spent 2 years on, and they know a lot more than I do about public health.
All right, so next question is to Dr. Mendonsa. What do the Sacramento County volunteer opportunities look like, specifically for those interested in going down the psychology route? And to specify, are they similar to shadowing a professional?
Yeah, definitely. Lots of opportunities. I'm going to just say, email me directly if you're interested in that. That way I can link you up with the person who oversees our volunteer unit. But yeah, I've seen our volunteers do everything from working here in the office just to kind of get some general, like, how does everything flow? What do we do? I've seen folks out in the fields, actually shadowing folks. I still practice as well. I have a private practice and stuff on the side. And so I love folks to shadow me, as long as the patient and everybody is agreeable to it. Certainly I have no problem. And a lot of my staff would probably have no problem with you sitting in to see how an assessment's done and things like that. But, again, I could say that, but, it's up to the patient. So we always want to make sure that the patient's okay with it. But in general, we have our volunteers do a variety of things. And so sometimes folks will volunteer over here in my department, and then I'll also do some volunteer work afterwards in the mental health side to kind of get an idea about both. That way folks feel that they are well versed in the behavioral health. So behavioral health is kind of the overarching umbrella that holds kind of mental health and substance abuse. So a lot of times folks want to kind of get a little bit in both of those areas. And so we can certainly help you with that. But yeah, a lot of opportunities, everything from if you want to just do an office filing to out in the fields. But yeah, email me with your question, and that way I can loop you in with the volunteer coordinator.
So thank you so much for joining us today. Students, please help me thank Drs. Flynn, Drs. Mendonsa, and Marlee for their fantastic presentations.